Hello, Dr. Ghalambor and Bob from NorTex Spine Joint Institute, talking about sacroiliac or SI joint pain. So you have the sacroiliac joint here. It is considered the lowest joint of the spine, although it is not a true spine joint, which we call facet, F-A-C-E-T. Sacroiliac joint doesn't move much, so it usually doesn't get as much in trouble as the other segments of the spine, such as lumbar spine or low back, that are more mobile. But it is definitely a structure that can get worn out, like any other joint, wear and tear of it, arthritis. If there's no reason other than just wear and tear, we call it osteoarthritis, but you can have rheumatological problems that would attack the sacroiliac joint, and you can get sacroilitis or inflammation of the sacroiliac joint. In those conditions, one of them would be ankylosing spondylitis. Typically, those have some abnormal radiological changes. Typically, we can diagnose them with advanced blood work or x-ray. But the most frequent thing that we see is somebody walking in and say, hey, I was told by my physical therapist, personal trainer, massage person, I have SI pain, so can you treat it? And like many other conditions, the key to treat condition, especially when it comes to spine, is the correct diagnosis. So if you have pain in the buttock, there are a lot of reasons for that. One is sacroiliitis or SI joint pain. One is piriformis syndrome. One of them is degenerative disc disease in the lumbar spine. One of them is facet arthritis. And all of them really can present with a similar pattern and location of pain. So really getting to the bottom of these is medicine mixed with art, mixed with experience, and that's why it's so important that you seek care when you have these, not from somebody that is, a family doc. And again, nothing against those great guys, but when it comes to spine and joint, you want to get care from somebody who's fellowship trained and board certified in advanced procedures and is able to get to the bottom of it, make the right diagnosis, and then treat it. So for sacroiliac joint, how do we diagnose it? We do a diagnostic sacroiliac joint injection, typically under fluoroscopy. Again, somebody said, hey, I got a sacroiliac joint injection without x-ray. They really got a trigger point injection. You do need x-ray to be able to correctly say the needle ended up in the joint, inject contrast, make sure you get good spread of the contrast within the sacroiliac joint, then inject it with medicine, which is typically a combination of local anesthetics and long-acting granulate type of steroids. If you get significant improvement, that confirms the diagnosis of sacroiliitis. If you don't, it rather excludes that diagnosis. Thank you so much for watching.